Good morning, everyone. My name is Vedant Naik, and I'm honored to be a part of the 2025 Student Speaker Series here at GHLC. Today, I'll be presenting on a topic that sits at the intersection of climate science, infectious disease, and global health: the warming world climate infection connection. So, here are a couple things about myself. I'm a rising senior at Castro Valley High School in Castro Valley, California. In terms of my research experience, I've previously interned at UC Irvine for neurochemistry research, and currently I'm serving as a computational biology intern at both UCSF and San Jose State University. Previously, I published a paper on the impact of the Achilles tear in professional and high performance athletes. At my school, I'm the founder and president of our HOSA chapter, and my future interests lie in biology and neuroscience research. So, over the course of these last few years, climate change has really emerged itself as a threat to health security. It is shown that it is no longer a distant threat. It's reshaping global health worldwide. Weather patterns are impacting the spread and intensity of vector-borne diseases, and ultimately, climate change has been endangering global populations. So, let's begin with the data. We're seeing a rise in atmospheric carbon dioxide, global surface temperatures, ocean heat, and sea levels. But what does this mean for health? Well, it means that weather patterns are changing. They're creating ideal conditions for vectors such as mosquitoes and ticks, and diseases like malaria and dengue are no longer confined to the tropics. They're on the move, and so are the microbes that they carry. Next, this leads us to what I call the climate cascade. First, warming oceans melts ice, which raises sea levels and increases flooding. Flooding contaminates water supplies and becomes breeding grounds for cholera, hepatitis A, and West Nile virus. Meanwhile, rising temperatures causes droughts, forcing humans and animals into tighter spaces and increasing the risk of zoonotic spillovers like Ebola. Ultimately, all of this overwhelms these fragile health systems, especially in low resource settings. According to a 2022 Nature climate change study, a staggering 58% of all infectious diseases have been aggravated by climate related factors. Think about that for a second. More than half of them have been impacted by this. From waterborne pathogens like Vibrio to the thawing of permafrost that may release ancient viruses, we're opening microbial doors we aren't prepared to close. Next, let's look at some examples of vectors and climate change influence. Malaria is now moving to higher altitudes in Africa and South America. Dengue is reaching over 100 countries, and diseases such as Zika and even anthrax from thawed permafrost in the Arctic are spreading in unprecedented ways. So this chart here basically breaks down all of the diseases, their pathogens, their source, and then the areas in which the regions that are affected by the disease, as well as the climates that they kind of target. So, for example, you can see dengue right here. It's basically worldwide, it's basically global, and has amassed about over 100 countries. And then diseases such as malaria have only affected countries like Africa, Colombia, and Ethiopia, but they have significantly different climates compared to some of these other diseases. So, as we talked about in the previous slide, we basically went over all the different diseases, as well as kind of the territories that it has amassed. But when facing pandemics and these other kind of global health disasters, the United States especially, we face a lot of current setbacks that need to be addressed, particularly with COVID-19. So the COVID-19 pandemic delayed a significant amount of efforts in disease surveillance. Funding for vector control had been stagnated. And many of the infections that were accelerated by the climate change, like Nipah, have no longer have no vaccines or forms of treatment just yet. On top of that, we're battling kind of antibiotic resistance which makes traditional responses significantly more effective. So, kind of talked about in this slide, we have the treatment gaps for the emerging diseases, as well as the need for enhanced surveillance. So, what can we do to address these issues? Well, global partnerships should be kind of had in order to ensure health for all, particularly the approach of One Health. So, One Health recognizes that the health of all people is connected to the health of animals and the environment because people are largely responsible for the conditions of animals, and they have a large influence on whether those animals become endangered or even extinct. So, we need to recognize that there is a correlation between these groups. Surveillance and monitoring need to be increased. Expanding disease tracking in these undeserved regions can be used using advanced tools such as genomic sequencing, and data should be used in order to inform timely local and global policy responses. Furthermore, we should incorporate strategies to reduce the environmental pollution. We can do this in one way by enforcing regulations to reduce industrial waste and prevent deforestation. Next, we need to have a lot of investment in outbreak response and really gather everything to execute in those areas. And finally, we need to raise public awareness of what is happening in these other climates and make sure that everyone is on board and fully aware of how we plan on going about this. Building on this, we have the emerging actions that impact the climate change. So kind of continuing on with this previous slide, we need to make sure that we are embracing sustainable solutions in healthcare. And carbon neutral healthcare means that we are reducing the greenhouse gas emissions from healthcare operations to net zero, whether it's through direct reductions, such as like us kind of doing that directly, or by offsetting the remaining emissions with carbon removal projects. So either kind of targeting it head on or using other projects in order to kind of get where we want to be. And ultimately, with our sustainable solutions, we want to reduce the carbon footprint. So a couple kind of groups that have really put this idea into effect are Kaiser Permanente, one of our local healthcare organizations, as well as the country of India and their government. So Kaiser Permanente was the first healthcare system to achieve the carbon neutral status since 2020. What Kaiser did was they reduced the energy, switching to green renewable energy, which ultimately led them to reduce waste as well as emissions. Through their offsets, policies, and new infrastructure, Kaiser's organization, their hospital and medical buildings no longer have a carbon footprint, which has really allowed them to achieve this green status and ultimately create a better environment for not only themselves, but for the rest of the world in general. On the other hand, the country of India utilizes solar-powered hospitals and clinics. An example of that is called Vistex Hospital of Bihar, in Bihar. And basically, they use on-site solar energy generation, which is really efficient and ultimately helps the climate a lot. What this has done is that it's improved the reliable access to healthcare for them, and really enhanced things such as vaccine storage and preparation, and allowed hospitals to more efficiently kind of do their medical procedures. Another very important area
next, kind of talking
is
about
how we
leveraging
plan to leverage
technology.
technology.
We're seeing AI tools
So
like
currently we are
EpiWatch
seeing
being used
tools
for
such as
real-time
EpiWatch
outbreak
being
detection,
used for real-time
even faster
outbreak
than some
detection,
official
even
sources.
faster than some
At
official
Johns
sources.
Hopkins, researchers
At
are
Johns
training
Hopkins University,
models
researchers
to
are
predict
training
mosquito-borne
models to
outbreaks
predict
like
mosquito-borne
Zika
outbreaks like
based on
dengue
environmental
and Zika
patterns.
based on environmental
This kind of
patterns.
technology will be the key
Such
to helping
technology
us stay
will
one
be
step
key to
ahead.
staying one step ahead and allowing us to get where we want to
So
be.
next, kind of talking about our leveraging.
So here is our call to action. In order for this plan to kind of go through, we need to make sure that there are stronger policies implemented. We utilize smarter technology and sustainable healthcare solutions that don't just heal people, but also heal the planet as a whole. Because if we want to prevent the next pandemic or kind of healthcare outbreak, we need to think globally, act urgently, and prepare now in order to address this issue. Here are my cited sources and references for my presentation. This concludes my presentation. If you wish to contact me, here is my name, my email, and my LinkedIn. Thank you so much.